Hello, and welcome to a brief introduction to interprofessional collaboration for direct care workers. My name's Bethany Dizer. I'm a nurse and a nurse practitioner, and I'm doing this program as part of a postdoctoral fellowship with the Impart Alliance, a group that works very often with direct care workers. So I'm very excited to have you join us. A brief introduction of the program. The goal is preparing professionals for work with older adults in long-term supports and services, prioritizing a holistic, person-centered approach to care. The learning objectives of this whole program have really been tailored to revolve around professionals uh, working with other professionals, as well as improving your direct care worker specific skills around working with older adults. The structure will include this brief 30-minute video that we're going to review some definitions, concepts, and strategies. And then on the 8th, you'll come in and have a class with medical students, and then have an activity with nursing students. And then the following week on the 15th, everyone is going to come together, all the nursing students and medical students and direct care workers, and work on an unfolding case regarding the care of older adults together. And I think it'll be a pretty exciting activity and an opportunity for everyone to learn something new from each other. So let's jump into some concepts about interprofessional collaboration. Our learning objectives in this video are going to be to define interprofessional education and collaboration, identify examples of interprofessional collaboration between direct care workers and other healthcare workers. We're going to describe the use of person-centered thinking in interactions between direct care workers and healthcare workers. We're going to define geriatric syndromes and consider the responsibilities of direct care workers when they are working with a person who has a geriatric syndrome. And then we're going to demonstrate the use of some common communication strategies for direct care workers when communicating about healthcare. So what is interprofessional collaboration? It's a comprehensive approach to services that involve multiple workers, and it can be all types of workers, all types of settings, and really any discipline. So disciplines might include nursing, medicine, but also physical therapy, speech therapy, mental health, dentistry, and direct care work. Interprofessional education is when two or more professionals are learning about, from, and with each other. And it's done to facilitate collaboration and to improve health outcomes for the people that all those professionals work with. So here are some examples of interprofessional collaboration involving direct care workers, nurses, and doctors. And you're probably thinking to yourself, have I done any of these tasks, right? Maybe notified a nurse about a change in condition, or helped take a person to the hospital or emergency room, or contacted an ambulance on their behalf. So lots of different things that a direct care worker might have done. And when we think about these direct care worker activities, we really want to start to think about what might be of interest to nurses and doctors as we get ready to work with the physicians and medical school students, so that we can talk about how direct care work influences and improves the health outcomes of the people that they work with. I think it's really important that these students have the opportunity to learn from a direct care worker about what direct care work means to the people that they're also caring for, that maybe they didn't have insight into before. So perhaps things like assisting someone with medications and treatments, supporting someone to use medical equipment correctly, right? Ensuring that it's being used properly at all times. Assisting someone with a physical disability to complete an ADL in such a way that avoids injury, right? Very often you might think someone uses a cane, but if you're not carefully paying attention, if they use their cane incorrectly, they could have a fall. Direct care workers are very often reporting a change in condition to perhaps a nurse or perhaps a physician. Direct care workers support individuals with hygiene in a way that reduces the risk for infection. Direct care workers promote strength and balance in people by encouraging a safe and regular physical activity and assisting them to do whatever activity is preferred for them. Direct care workers support the mental health of the people that they work with by reducing social isolation and encouraging healthy communication. And physicians and nurses should understand that direct care workers help people obtain meals that can meet their health needs, as well as their personal preferences, right? So Direct care work uses person centered thinking to make decisions about how to support the individuals they work with. On the left hand column are kind of just a list of the characteristics of person centered thinking. And on the right is how it can relate to applying it in an interprofessional collaboration setting, right? So when we think about person centered thinking, we're focusing on the individual and their own strengths and abilities. We're making sure individuals are able to make their own decisions as much as possible. We're respecting the personal choices of the individuals we work with, and we acknowledge that individuals are the experts in their own lives. It's really important then to make sure that interprofessional collaboration around that person remains person centered by making sure the group is focused on the person. They are not acting as a substitute for that person's own decision making, right? The person's preferences and priorities should be the loudest voice at the interprofessional collaboration table, right? Not any one particular professions. And referring to person centered thinking can also help to address disagreements, right? All these different disciplines may have slightly different goals and objectives, but if we can all remember that the person centered approach is most important, we can usually identify how to prioritize when there's a disagreement. So, what does communication in healthcare need to be? It's really important that we are able to communicate in a way that's accurate and everyone ends the communication with the right information. We want to make sure our communication is timely, right? Anything that's urgent doesn't get delayed. And the time frame should be determined by the nature of the problem. We want to make sure our communication is clear, that everyone can understand what we're trying to relay to one another. And we want to make sure that we're prioritizing our communication, that the people who need to know are receiving it and it's understood how important it is to both parties. So let's talk a minute about geriatric syndromes. Definition just means it's a complicated series of problems that cross the boundaries of a single body system or discipline. So geriatric syndromes impact a person's quality of life and functional abilities. If you're a direct care worker and hearing the term geriatric syndromes for the first time, it's pretty clinically specific term, but it probably describes a phenomenon that you've observed when working with older adults. There's certain things that happen that aren't just one problem, it's more of a pattern of problems or a constellation of problems that older people are just more likely to have. So let's look at some examples to clarify. Falls and dizziness, cognitive impairment or memory loss or trouble thinking, pressure ulcers, which are sometimes called bed sores or any kind of pressure wound, sleep problems, hearing and vision loss or difficulty, urinary incontinence, right? Loss of control of the bladder, weight loss or nutritional issues, right? Trouble eating, trouble swallowing, inadequate intake of food. And then constipation and fecal incontinence are both also geriatric syndromes, right? A lot of different challenges with bowels as you get older. So again, geriatric syndrome is a very clinical sounding term that describes just these different groups of phenomena that can happen for all different kinds of reasons and have all different kinds of effects, but we see these clustered patterns in older adults. And you've probably cared for someone who has at least one of these issues going on. So, since these geriatric syndromes are interdisciplinary problems caused by multiple factors in aging, and they have a variety of effects, it makes sense that we use different ways to describe them, and we all have different words to describe the activities and treatments that we use, right? Between nursing, direct care work, and medicine, all a little bit differently. But I want to make sure that we're looking at what is shared among all of our professions when it comes to geriatric syndromes. And that is that we all play a part in each category, maybe doing very different things. So, movement. What might a direct care worker do in this group of challenges for people with geriatric syndromes? Direct care workers might help identify people who have trouble getting around or times that they've seen risk. They provide the right amount of support for people with moving, and they prevent problems like immobility, falls, weakness, or discomfort from trouble moving. What do direct care workers do with all different types of challenges related to elimination? Remember, we talked about bowel and bladder challenges. They identify people who have trouble with emptying their bowels or bladder. They make sure that people have the support they need to avoid the discomfort, illness or infection, or the loss of dignity related to incontinence, right? That's very important. Direct care workers work with people with nutrition challenges, right? They help people to get access to and consume their preferred nutritious diet. They support people who have alterations in their intake, right? Making sure people who don't have enough to eat have access to more, or people who have trouble with keeping track of too much to eat, um, maybe have some cueing and supports to eat a little less. In terms of the mind is a big category, right? It includes our memory, our mood, and our thinking. Um, and so direct care workers really do make sure that they're providing holistic care to the whole person, right? That includes their physical care as well as asking about their mood and their memory and engaging with the mental self of the person as well by conversation or encouragement or emotional support. And skin breakdown, direct care workers play a very important role in identifying people who are at risk to get pressure injuries or skin breakdown problems and engage in the activities that preserve healthy skin, right? We do things like encourage mobility and clean skin. So now that we've looked at all these categories of geriatric syndrome, just a review of the different responsibilities of the different professions. Direct care worker, we've talked about pretty extensively, right? Supporting ADLs, IADLs, monitoring, reporting, and documenting change, and that includes emergency responses. So what do nurses do? Nurses care for older adults with geriatric syndromes by recognizing the impact of their current health status on the development and progression. Nurses develop nursing care plans that are informed by required functional support, medical interventions, and the goals set in partnership with the person. Physicians working with older adults perform evaluations that include an inventory of someone's functional status, and then they order treatments that are supportive, palliative, which means managing the symptoms, like providing comfort or relief from symptoms, and then curative, which means reversing the actual disease process that causes the geriatric syndrome. So I hope that these last few slides, it's a lot of new information, but I hope they can help to define geriatric syndromes and clarify two main themes to the interdisciplinary approach. That the risks for and the effects of geriatric syndromes are not limited to any one type of person or any one body system. It can be a whole series of problems. And that also people with a geriatric syndrome benefit from the supports and services of all three professions listed on this slide. It takes a team approach to manage some of them. So, what are some serious health and safety events that occur when communication breaks down? This is our next topic. So, perhaps you're thinking of a time in your work where communication was either incomplete or inaccurate and caused a serious safety problem. I've encountered some of those while working as a nurse, and they often involve multiple people. One example I can think of includes medicines. When there are several specific details in an order for a medication, how much to take, when to take it, how to take it, if not all of them are communicated correctly by the person who ordered the prescription and the person who's taking the prescription, you can run into some real challenges. And people have had very serious adverse reactions to that. So we're going to go over some strategies that can make communicating between different professions more clear and more complete. The first thing I would say is as simple as clarifying and repeating back to double check, right? If you're working with someone and their family member tells you something about them, like, oh, Mr. X eats a low salt diet, you could clarify and confirm and say, okay, I'll support Mr. X to eat a low sodium diet, correct? And that way you just know, right? In case you saw it and thought maybe it meant a higher sodium diet, right? And you wouldn't want to give the wrong type of diet. So, what are some strategies for communication? The first tool that I like to use is just some standardized phrases for speaking up when something could potentially lead to a dangerous or bad outcome. These phrases are sometimes called the cuss words, which is the only kind of cuss words we should use at work, right? Um, but they were designed to prevent safety events in hospitals, like someone being given the wrong medication or getting the wrong type of surgery in the operating room. It was meant as a way to deal with situations where there's power dynamics that include someone giving someone else instructions. And then that person has the ability to stop the line and address those instructions if they aren't safe. So, the example of how these tools were developed in the hospital included doctors and nurses working together. So maybe a more senior doctor orders a medicine and the patient might be allergic to it, and the nurse knows that person's allergies, and they would say, I have a concern. Mrs. Smith's husband told me that she's allergic to this medication. And if the doctor didn't stop and listen to the nurse could escalate and say, I feel uncertain about giving it. What if she has that allergic reaction? And if it still can't be addressed and have the order discontinued, they might raise the alarm and say, this is a safety issue. It would be unsafe for me to give this medication. So, why does it seem so repetitive? It's to help people to overcome those perceived barriers that maybe someone else won't understand what they need or won't acknowledge the importance of the concerns they have within their profession because of power dynamics or because of workplace um, challenges and dynamics, right, between people. We can fall into patterns of listening in only one direction or speaking in only one direction without listening back. So, this kind of tool helps to use these key phrases that will hopefully stop the line and raise people's awareness, right? If someone said to you, stop, this is a safety issue, you would probably be really shocked and stop and at least stop and think, what are you talking about? What's going on? And work through it with that person. And that was really the goal of using these standardized, clear phrases like, I have a concern, I'm feeling uncertain, or this is a safety issue. Our next tool is sometimes called the S bar or the IS bar, which is a mnemonic device to make sure you have all the communication elements necessary when talking out about a problem. Um, and they can be really straightforward. And the goal here is just to make sure that we all talk about things in our own professional way. And we might not understand other professions in the way that they communicate and prioritize or what they call things. And the goal here is that if we all use a standardized approach and we talk about the same elements in the same order, we won't leave anything out or miss any parts of it, right? So, this is a great tool to use if you're perhaps reporting a change in condition to a physician or a nurse. So, how uh, you might use it, you would start off by introducing yourself and the person that you're talking about. Make sure you know who you're talking about, right? With the person, and they know who you're talking about as well. You're going to give a quick headline of what the situation is. Then you're going to provide any details that apply to the situation. And then give your assessment, what you think is really going on. That just means like your understanding and judgment of something. And then finally, you're going to give a recommendation. What do you think needs to be done to solve the problem? Direct care workers using an S bar, what kinds of concerns do you think people might run into? Um, I wonder if they would be concerned about this term assessment, right? Does that maybe feel very medicalized? Like maybe that's something a physician should make? Don't be intimidated by making an assessment. It just means you've taken in all this information and here's what you think. Same with recommendation. If you feel like you're making a recommendation to a nurse about their nursing care, maybe that's not something that you would know what to do. but at least to give the recommendation of, I think you need to help, is a legitimate recommendation as well, even if you're not sure what the nursing intervention would include. I think there's a huge amount of insight that direct care workers can provide using this format, right? Because they're so familiar with the people that they work with. They're very aware of all the situations going on with that person. They're attuned to the background of what it's like to work with them day to day and can identify any kind of change from that normal background. Um, so consider maybe adding this into your toolbox of ways to communicate with your coworkers, with your supervisors, with the people that you work with. So here's my example. If I was a direct care worker, so this is an example of a direct care worker calling a nurse at the home health nurse's office about a person that they're working with having a change in condition or a health symptom. So you might call and say, "Hi, this is Cheryl. I'm the direct care worker for Mr. Sam Jones. I'm calling you because Sam has a really bad cough. His cough started yesterday, it's getting worse today, and he told me that it hurts in his chest when he's coughing. I'm calling you because he had a bad cough like this once last year, and he had to go to the hospital for it. I really think that he should see a doctor or a nurse or someone soon, right?" And then if you wanted to use your other tool, right? If the nurse perhaps didn't understand the priority that you're giving this, right? It sounds like it's a pretty high priority to Cheryl, the direct care worker, um, concerned that he might have to go to the hospital. But let's say the nurse didn't acknowledge or realize that urgency from Cheryl and said something to the effect of, "People cough. I'm not that worried about it. Just watch him." And Cheryl feels like, "I really think he should see a doctor or a nurse soon." Perhaps that's an opportunity for Cheryl to use some of those cuss words like, "I have a concern that this cough is getting worse and could be really serious." And then if still no response there, say, "I'm feeling really uncertain about Sam being here without having a physician or a nurse examine him to make sure that he's not getting sicker." And then if you still weren't getting an appropriate response, right? If you were getting like, "People cough, don't worry about it. You don't need to do anything differently." Say, "This is a safety issue. I really think his cough needs to be addressed because it could put him back in the hospital," right? So just an example of how to integrate all those different communication tools that help to standardize communication between different professions that have different priorities and different ways of talking and approaching things, um, ways to organize all your thoughts and observations as a direct care worker, because we've gone over that big list of all the ways that direct care workers work is so important to the health of the people that they work with. And we've also reviewed a little bit about these geriatric syndrome concepts, which we'll be going over in more detail in our class later this week. So I really want to thank you for taking the time to listen to this quick video, learning a little bit about interprofessional collaboration and education. I hope that when you come and meet some of the other students, if you are more experienced in using person-centered thinking, you can really share some of that experience and insight um, and practice some of these strategies for interprofessional collaboration. Thank you so much for taking the time for joining us for this activity, and I am looking forward to meeting you in person soon. Thanks.